Hi, my name is Eli Schiffler, and for my presentation, I did Chapter 8, Module 7. It was Hormonal Methods, Emergency Methods, and Permanent Methods, and this was page 179 to 186 of the book. Now, to start off, the term hormonal contraception refers to birth control that contains synthetic estrogen, progestin, which is synthetic progesterone, or both, similar to the hormones estrogen and progesterone that a woman's ovaries produce naturally. Synthetic estrogen works to prevent the ovaries from releasing an egg, while progestin thickens the cervical mucus, which hinders sperm movement and inhibits egg travel through fallopian tubes. It also suppresses sperm's ability to unite with the egg and thins the uterine lining, reducing the likelihood of a fertilized egg implementing in the uterine wall. Now the most popular ways of oral contraception are oral contraceptive pills. They were first marketed in 1960, and they're now one of the most leading ways of contraception with college women. And they have a 91% success rate, with most failures actually being through user failure. And they must be taken every day at the same time without fail. Now, the two types of pills are combination pills and progestin only pills. Combination pills are pills that work through the combined effects of synthetic estrogen and progestin and are taken in a cycle. At the end of each 3 week cycle, the user will actually stop taking the pills or take placebo pills for a week. And then menstrual flow after this would actually be lighter. Now, obviously, the advantages: it prevents pregnancy, it'll lessen menstrual difficulties such as cramps and or premenstrual syndrome, which is PMS, and it will lower risk of health difficulties like ovarian cancer. Disadvantages, though, is that it can pose health risks for women older than 35 and also women who smoke. And these health risks can be blood clots, increased blood pressure, thrombotic stroke, and myocardial infarction. And it also can cause moodiness, nausea, breast tenderness, and even a lower sexual desire. Now, for the other pills are progestin only pills. And these are similar, kind of, except that they contain small doses of progestin and no estrogen. And these pills are available in 28-day packs of active pills. Ovulation may occur, but the progestin prevents pregnancy by just thickening the cervical mucus and interfere with the implantation of fertilized eggs. Advantages, very similar to the other ones. However, it can also be safer for women who smoke and for women who are over 35. If you take it 3 hours late, though, you can honestly lose all the effects that you had kind of had. And it's the same as just not doing it at all if you're late, which is one of the biggest disadvantages of this. And it can reduce your sex drive, moodiness, headaches, and you can even have irregular bleeding. Now, after pills, you can also try patches. Patches are something you just put on every or on this day. One okay, sorry. It is worn for 1 week, replacing the same day of the week for 3 consecutive weeks. And then during the fourth week, you don't even put on a patch. And it just works by putting estrogen and progestin actually just into your bloodstream through your arm. Weekly use and not daily, which is a nice advantage because you might not forget as often. It can also reduce certain cancers like ovarian cancer and even diseases, and then it also lessen your PMS symptoms. Disadvantages, though, is that it can take a week to start working, so you have to make sure you use protection before that. And you don't really have protection against HIV and STIs. Sometimes the patch can fall off, but you don't shouldn't be too concerned. Just make sure you have it before having sex. And it exposes women to more estrogen than the pill, which can be bad. Now, the next is a contraceptive ring. A contraceptive ring is something you just put into your vagina and then you leave it in place for 3 weeks and then you remove it for 1 week, and during which you will have a menstrual period. And the best advantage is that it has a pretty good success rate, low user error because you'll have some medical person do it for you. And then a really cool part is that your fertility will actually come back right after you stop. Um, Disadvantages, it requires an initial examination prescription, which could just be a lot more prep, and you gotta like it's not something you can start right away. And also will take a week to work. And yeah. Now the next one would be injections. Depot Provera and Depot Sub-Q Provera are the most popular ones. They're long-lasting progestin injected every 3 months by a healthcare provider. They prevent ovulation and they thicken your cervical mucus and then thin the uterine lining, all of which will prevent pregnancy. Now, advantages: this takes effect in less than 24 hours. Very little room for user error just because someone else is doing it for you. no estrogen-related health risks, and it can be used for women who are even breastfeeding. Um, Disadvantages, kind of like the other one, you have to get an exam before it. You have to go in for a shot every 3 months if you're not a big shot person. There's no STI protection. You can have a regular bleeding at first, but as time goes on, you'll lose that. And then what's weird is that you can also gain weight and then even lose bone density. And then if you're gonna want to have a baby after this, effects can linger for up to 6 months after. And the next one I want to talk about is implants. These are just soft plastic capsules that are inserted into the skin on the inner side of the upper underarm by a healthcare provider. And what's cool about this is it can last up to 3 years, and it'll just give you steady doses of progestin. Advantages, it's pretty discreet. You don't really notice it at all. It's pretty like hidden. Very low chance of having a unplanned pregnancy, 1%. And it only needs to be replaced every 3 years. So it's not something you have to do all the time. And then when you're done, you can just take it out and fertility will actually be literally, you'll gain it right back. You'll have little to no periods, which is really cool. Now, disadvantages, since this is kind of something you have to inject, it will be a little bit of higher cost. Insurance can cover this sometimes. Just because you put something in your skin, you can get irritation, allergic reaction, infection, and then even complications of the removal if it moves around. And this isn't as effective for overweight women, unfortunately. An IUD is something that's placed in the uterus through the cervix and provides protection for pregnancy for 3 to 12 years. It's not totally known why it's worked as of the book, but it's believed to work by affecting the way sperm move towards the eggs. This used to be really popular, and then it kind of died down. Now it's actually kind of getting a resurgence of popularity. And there's 4 big IUDs. There's Paragard, Mirena, Skyla, and then Liletta. Each one has their own kind of pros and cons, and you can kind of choose based on what you feel like fits you the best. The advantages, there's less than a 1% chance of failure. It'll last 3 to 12 years, which is the longest lasting you can get. There's no hormone side effects with the Paragard, and then it can actually be removed at any time to regain fertility, which is really cool. Disadvantages, it can be kind of discomfortable to insert and remove. There's no HIV or STI protection. And because of the hormones from Paragard, you can get really severe cramps right away. And you can also get headaches, acne, mood swings, and backaches. These don't happen right away, but they will go away eventually. Now, away from contraceptive methods are behavioral methods. And these are more just rely on self-control, like diligence, commitment. And this also can kind of make it more prone to user error than the methods before. The first, as a lot of people know, is a pull-out method. This is very popular among college students, unfortunately, despite it having a 22% failure rate. Um, it's just so unreliable, honestly, even with perfect use, because there's just 500,000 sperm and just a drop of pre-ejaculated fluid released before ejaculation. And time withdrawal can be difficult for some, and it can also even just make it so stressful that sex isn't enjoyable. Very low protection with STIs, and it's not good. Another method would be abstinence and or intercourse. Abstinence is just getting rid of all types of sex or any of it, and really just having like kissing and massaging. And then if you want to go beyond this, this would be outer course, and this is where you would include oral sex or mutual masturbation. Advantages, you can't 100% chance of no pregnancy if you don't actually have sex. There's no STIs with absence. However, intercourse can result in disease just with the oral sex. Disadvantages, it's just kind of a lot of commitment and discipline for couples. And the last one is fertility awareness methods. This is just timing when the menstrual cycle is. There's 3 ways of this. There's a cervical mucus method, body temperature method, and then the calendar method, which is the most popular, where you just track a woman's menstrual cycle to determine whether or not it's safe to have unprotected sex at that moment. Because sperm can actually stay in the reproductive tract for 7 days. So the goal is just not to have sex 7 days before the ovulation and during ovulation. Now, emergency contraception, also known as Plan B, is just something that you can take either morning or 2 after. That will just put a lot of estrogen or progestin, and it can actually just get rid of the pregnancy up to a 95% success rate. There are ones that last 5 days. However, this is pretty risky because after 5 days, it can be lower chance. It's like around 70% success rate, unfortunately. Now there's also permanent methods, also known as sterilization, and this is a lot. This is a very popular thing with people over age 35 who aren't really looking to have kids anymore in their life. However, because it is permanent, it's definitely something you gotta like think about a lot before. The first one is female sterilization. There's four kinds. The two that include surgery would be tubal ligation, which is just tying the fallopian tube so that the egg will just disintegrate. Um, and then a hysterectomy is where you remove the whole uterus. Not really a method you want to do. It's more if there's disease or it's damaged. And then the two other ones are Assure and Adiana, which is just putting something inside the fallopian tubes that'll eventually expand and it'll fill it up and it'll just block the fallopian tubes from actually having sperm being able to reach the egg, which is really cool. Advantages, very low chance of unplanned pregnancy, less than 1%. It is only a one-time procedure. There's no effects on sex drive. And what's really cool about the Escher and Adiana methods is that they don't even require an incision if you're scared of surgery. Disadvantages, it's permanent. You really got to think about this before. You can't just switch up. You technically can, but especially with female sterilization, it's very not recommended. There's also just surgery risks, of course. With all surgeries, there will be risks. And for permanent male sterilization, there's one big method, just a vasectomy. And this is where you would just cut the vas deferens on both sides and then either tie or cauterize it so that sperm can't get through anymore. And the advantage of this is that you'll very, very, very low chance of having a planned pregnancy. It uses no hormones and there's minimal recovery times. And technically, it can be reversed. If you were to go with the sterilization methods for both genders, this is the preferred one to probably get reversed just because of the low risk, a lot more low risk. No STI protection, unfortunately, and obviously just surgery things can go wrong, blood clots, infection, inflammatory reactions. And yeah, so that is my presentation on different types of contraceptive methods, and I hope you all learned something and you all could kind of use this information in the future to help prevent unplanned pregnancy. Thank you for listening.